Well, hey there, welcome. This is Here's to Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center here in Rocky Mount, and if you've been watching this station tonight, you would have seen Dr. Michael, who is the founder of Rocky Mount Family Medical. He's doing something a little bit different, which is called MDVIP. I'm not going to really go into that, but anyway, it was kind of funny to see him here when I was pulling up, getting ready to start my own show. But anyway, it was nice, and he had Dr. Cromwell, who is a lipidemiologist, a specialist in lipids, and he's smart as heck. He's a really nice guy, but boy, he can go way over my head. So anyway, good evening. It's good to see y'all. I do not have a guest tonight, so it's me, myself, and I. And I thought we'd talk a little bit about the stress and anxiety of this COVID stuff. You know, people are they're kind of going nuts. I'm not talking about all the chaos and all the, Black Lives Matter and, and defund the police and all that. I'm not going to talk about any of that. But just the COVID itself is enough I have so many patients that come in, they're so stressed out. Kids are stressed out. They can't see their friends. They can't go to school. And I'm not here to tell you what is right and what is wrong, because I certainly don't know. And I feel sorry for anybody in government trying to figure that out. I know what we go through in our office trying to figure out what's best for our patients and what we need to do to give them the care that they deserve and the care we want to give them. Sometimes we got to treat them out in the car, in the back parking lot, because our office is very strict about, let me take these glasses off to give me a headache. They're very strict about anybody coming in the office. If you don't have a mask, you can't come in. I had a patient today who absolutely refused to wear a mask, so she could not come in. I had to go stand out in the backyard, in the parking lot, under a tent to talk to her because she will not wear a mask. So, and she wanted me to write her a letter for her employer saying she doesn't have to wear a mask. Well, I'm not going to do that until I know exactly why, and she said it was anxiety. Well, I treat some anxiety, I do, but I don't feel like my licensure is strong enough or is, if that's the right avenue for me to take to diagnose that kind of thing in this situation. And she's a teacher. So if she goes back in the classroom, she's going to, be around a lot of little children, and I'm not going to say that she can go maskless. I'm just not going to do that. So I referred her to a psychologist, and he or she can talk to her and determine if her anxiety is so high that she can't wear a mask. She said that when she put one on, I think she said she was getting her hair cut. And she said, I was sitting there with the mask on, and then I started getting real flushed, and I started breathing a little fast, and I just felt real anxious and nervous. And she said once she just pulled the mask down under her nose, she felt better. And so I said, well, I get it. I don't like wearing a mask either. I hate wearing a mask to go see my patients. I had to take it off my face for a lady today who's very deaf, and she lip reads. Well, you can't read my lips if they're covered. So, there's exceptions to every rule. I don't like to do that because the requirement is of me to wear a mask with any patient. But, I had to be able to communicate with her too. So, but, I don't like wearing a mask. I get where people don't want to wear masks, but my employers have said you will wear a mask when you're with a patient. You will wear a mask, when you are out in the walking through the clinic. Let's say I wanted to go leave my desk and get some water from the water fountain. Well, then I've got to put a mask on to do that. When I'm sitting at my desk and with my computer and it's just me, I don't have to wear a mask, and I don't. But any other time I do. And so I told her, I said, well, what you need to do is wear the mask around the house and wear it for a while, and then when you start feeling that anxiety, take it off. A little while later, put it on and develop a tolerance to it so you can wear the mask. And they also have these face shields that it's like, it fits around the top of your head here. It's like a headband, and then it's a clear shield that goes in front of your face. And I told her to check with her HR department. She works for Wake County Schools, to see if that would be all right, because that is a little bit more freedom. And those masks they can really irritate you. I was on vacation last week. I went to Minnesota, had a great time, wonderful, cool weather there. The highest I got was 75 or 76. It was cool at night. If you went out, you had to have a pretty heavy sweater. And it was cool in the mornings, like 55, 60 degrees when you got up. Of course, then, as the day went on, it warmed up again. But, so I went to Minnesota, and then my husband and I went to North Dakota for a couple of days. It was colder in North Dakota because North Dakota is flat. It's just flat. And they have a lot of wind there. And so the wind was cool. But it was really lovely. It was a great change of scenery, a great change of pace. I just needed to get away for a while. We all need that, don't we? We just, we go to the beach, or we go to the mountains, or... The only reason I even went to Minnesota, my husband plans a Navy retreat every year, and this year it was canceled, and we had some vouchers to fly, and so they were going to expire in September. So we used the vouchers, and he and I flew to Minnesota for $78 a piece round trip. So, it didn't cost me anything when I got there, because I stay with friends, and they're really good about feeding me. So, it was a pretty cheap vacation as far as spending money. And but anyway, I said all that to say this, that because I was flying, and we had a long layover in Nashville, Tennessee. We went from Minneapolis, St. Paul to Nashville, and then we had a 2-hour layover, and then we flew home. You have to have a mask on the entire time. And I had one of those blue ones, and it clips around your ears. But I was getting such a headache back here from the elastic pulling on my ears. And I found out that it'd be pretty tough to wear that 8 hours a day every day. So, but we had a great time. I enjoyed it. We had the flights are not real full; they're about half capacity. So it wasn't, hard to get a good seat, and it wasn't hard to, get your luggage and everything, and get your stuff off of the overhead containers there where you can put your carry-on stuff. So it was really nice, and I'm really glad I got to go. But, and who knows if I'll ever go back again. It's really pretty expensive to fly there. And but I've been, off and on, I've gone over the past years. You try to go back to my class reunion. But, because I lived in a small town, and my dad sent me to Catholic school, and so, these Catholic girls that I went to school with, well, boys too, but I didn't see any of them, we were in school together from kindergarten all the way through 12th grade. So I've known them forever and ever. And I still keep in touch with some of my really good friends. And so one day we drove from my hometown of Willmar, Minnesota, to a small little hole-in-the-wall dot on a map called Curie, Minnesota. And my friend and her husband live on Chetek Lake. And so we, several of us girls, my husband went to, and we spent time there. We had lunch there. And then we went out on their pontoon boat, and just, it was very relaxing just to, go and see it. And we have a pontoon boat, and I go out on the lake all the time at Gaston, but it was a different place, a different lake. And, so my friend's husband was pointing out all of the history and water tables and water levels, and how the erosion is changing the lake as it does everywhere. And so it was just really a nice time. It was really good. I really enjoyed it. And so we might go back to Bismarck next year if there will be a Navy reunion for my husband. This year's was canceled, and so I don't know about next year. We'll wait and see. But we may go to Bismarck next year for the reunion if they have one. So that's what I did last week, and it was great to be away. And then, of course, I came home late Friday, like midnight Friday night. And then I had Saturday, and I wanted Saturday and Sunday to kind of recuperate, and I didn't get a lot of rest on my trip because we were on the go a lot. But so I wanted Friday and Saturday to rest, do the laundry, check the mail, all that kind of stuff when you go on a trip and you're gone for a week. And I forgot that Monday was a holiday, so I had a 3-day weekend when I got back from Minnesota, which was pretty nice too. But I'm back in the saddle, so to speak. I'm back working, and of course it's a short week this week. I don't work Fridays anymore, which I really love. Excuse me. I'm always sleepy at this time. It's because I've been on the go since 5:45 this morning, and I pretty much haven't stopped till I got here. After work, I had to make a deposit in the bank, and then I went and got my hair cut. I grabbed something to go and ate a couple bites of food when I got here, and now I'm here, and it's just been one of those days where it's a go, 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 go day. But anyway, I'm blessed to be able to go. I'm blessed to be able to get up in the morning and read my Bible and have my devotion and drink my coffee and get ready for the day. And so I've had, yesterday was a really nice day. Excuse me. Today was a little bit more busy, and tomorrow will be even more busy. I'm always busy on Thursdays. I guess because I'm off on Fridays. I don't know why, but anyway, it's okay too. So we've been building a screened-in porch on our back, probably for the last year. It feels like it's been forever. But we had been at a standstill because we had ordered some special windows out of a place in Raleigh, and they didn't get here. They, of course, got here the day before we left on our trip. So, they would have already been in, and the floor would have been laid, and I've got everything. I got the windows, I got the floor, I got the paint to finish up the touches, of that, all that, but we just haven't had the time. So this Saturday, of course, I've got a commitment for about 3 or 4 hours Saturday, right in the middle of the day. But those windows are going up, the floor is being laid, and then I can look at this room and figure out what the heck I'm going to put in it, what I need, if anything. I don't want to buy anything new until I've been having stuff hanging around the house because I didn't know exactly what I wanted to do. So that will be my weekend project this weekend, along with weeding. I got my flower garden weeded. I'm on to my vegetable garden, which is, oh my gosh, you just wouldn't believe it. It is, the weeds are just astronomical. They sure do like donkey poop and chicken poop, because that's what we used for fertilizer. But, the other thing is we compost, and so, we took the compost pile and dumped that in there and then tilled it all up. And we had more volunteer plants. We had two different kinds of squash, butternut squash and acorn squash. We had volunteer cantaloupe, volunteer watermelon, a couple of volunteer tomato plants. So it was an interesting garden, to say the least. And then I did some canning too when I got back. I had some beets that I had to do something with, so I made pickled beets and just kept myself busy. I could keep myself busy probably all day doing stuff like that. I love to can, I love to garden, I love to be outside. But the winters would be mighty long and boring if I didn't work. So I'm not going to quit working. My friends, when I was in Minnesota, said, "So when are you going to retire, Linda?" Never. Not going to. I might cut down another day, year or two down the road, and work 3 days a week instead of 4. I don't know. But I like to work. I like what I do. I feel like I make a difference. I feel like I'm a blessing to my patients. And as long as I feel that way and think that that's what I can do, that's what I'm going to do. So, all right, it's time for our first break. I am live tonight. This is the 10th maybe of September. I'm live, and if you want to talk about something, anything, give me a call, 407-1111. All right, we'll take our first break, and we'll be right back.
At Downey's Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Downey's Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Downey's Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
Looking for an affordable option to treat erectile dysfunction? Ward's Specialty Pharmacy now has low-cost Tadalafil Troche. Compounded Tadalafil Troches are small lozenges that dissolve between your gum and cheek. Many ED treatments can cost hundreds of dollars. Take advantage of Ward's Specialty Pharmacy's competitive pricing. 10 doses of Tadalafil Troches are only $80. A prescription from your doctor is required. Call Ward's Specialty Pharmacy today, 252-459-5544.
The statement in this ad has not been evaluated by the FDA. This product is not intended to diagnose, treat, cure, or prevent any disease.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
All right, hi there, welcome back. I'm Linda Prezioso, a nurse practitioner at Family Medical Center, and this is Here's to Your Good Health, which is a show for you, by you, and about you. It's a community service sponsored by WHIG-TV, and it's been running quite a while. I think that I have been doing this 7 or 8 years, and it was on prior to me being here. So it's, I think, it's a nice show. People enjoy it. I've been told that anyway. People see me at the office or out and about and tell me they enjoy my show. I hope that's a true statement and they're not just saying something to say something. I don't know, but I like it. It's a good forum for me to promote good health. I'm all about good health, healthy eating, healthy exercise, keep your body fit and firm as much as possible. And so I thought tonight we'd talk about some of the side effects of this COVID. There's plenty of them. I call it the COVID-15, like, you have your freshman 15 when you go off to college and you gain weight. Excuse me. Every patient I saw yesterday had gained weight, so I said, oh, this is the COVID-15. So, but it's a real thing. People sat around, they didn't go to work, they didn't do anything but eat. They cooked more, they baked more, and so it caused a consequence of weight gain. Couldn't go to the gyms were closed, it was too cold in March and April to go and walk, and then it was too hot in June and July, so, people didn't exercise, and they got out of their normal routine, and that caused a lot of stress and a lot of anxiety. So I wanted to talk about both of those. I was going to start with the stress, but of course that's in the second. Hang on, let me find it here. But I've seen a lot of stress, and moms having to homeschool, having to get their kids set up on this Zoom, trying to make all that work, trying to work full-time, or not working full-time and cutting back on their income. I mean, there's just all these stressors in place. Moms, they're not used to teaching. They're not used to doing all that for the kids, and so that's been a real problem. I see how the nurses in my office struggle with trying to, handle teaching their kid and getting the homework done and still working all day, and then, cooking and cleaning and all the things that working moms do. So that's been a real stress. And then the kids are stressed. They want to see their friends. They're sick of looking at their mama and their brothers and sisters. So that's another stress. I've seen a lot of kids that are pretty stressed out, and a lot of parents, primarily women. I don't see a whole lot of men, but anyway. So this is from the CDC, and it says, pandemics can be stressful. Well, we sure know that, don't we? The coronavirus 2019 pandemic is stressful for people. Fear, anxiety about a new disease that could happen can be overwhelming, can cause strong emotions in adults and children. Public health actions such as social distancing make people feel isolated and lonely. That can increase your stress and anxiety. And but these actions are necessary, according to the CDC, to reduce the spread of COVID. I don't know if it's reduced it all that much, but I'm not going down there because I got my own opinions, and they're not like everybody else's. So coping with stress in a healthy way will make you, the people who you care about, and your community stronger. So, stress can be caused by fear, worry about your own health, about the health of your loved ones, your financial situation or a job, the loss of support services you rely on, changes in sleep and eating patterns, difficulty sleeping and concentrating. That's a big one right now going on. Worsening of chronic health problems, worsening of mental health conditions, increased use of tobacco and/or alcohol and other substances. And, we have a policy in our office that if you are on any kind of a controlled substance, whether it would be like Adderall for attention deficit, or some alprazolam for anxiety, or if you've got chronic pain and you take an opiate narcotic drug, you have to do a drug screen, you have to sign a contract. And the contract basically states that you will get your medicine from one pharmacy, you'll get your medicine from one provider, and that you will submit to drug screens. And so these drug screens are getting to be a real problem for these people, especially the younger ones. You know, I see a lot of marijuana in the drug screens. I'm not necessarily against marijuana. I don't know that it's all that bad for your health, but it's illegal. So it doesn't matter what I think. It's against the law, and I'm not going to break a law. So I've had to kick out several people from my office because they had other substances in their drug screen other than the Adderall, for instance. One guy had heroin, can't mess with that. Another gal, his significant other, had fentanyl, which is a very powerful pain med that I've given in the hospital under controlled circumstances, and it's a drug that they use for cancer patients. It's a very powerful drug, but it's a very prevalent street drug. And a lot of times these people, they get the Adderall, and they'll sell the Adderall to get fentanyl or something like that. So that's the reason we have that contract. That's the reason we do the random drug screens. So, like I said, there was a lot of marijuana. I had 2 girls I had to kick out because of marijuana. And they signed this contract saying if there's any substance in their urine on a drug screen other than what I have prescribed for them, that they will no longer be receiving those benefits. So the alcohol abuse and the other substances are really becoming a problem. And then people self-medicate because they're miserable. So it's just a bad thing all around. So, we need to take care of our mental health. It's very important. Mental health to me is as important as taking care of diabetes or high blood pressure. And, you're going to have some increased stress during this pandemic, and that fear and anxiety can be overwhelming and can give you strong emotions. So, if you're in a crisis, call 911, get immediate help. A lot of people don't. But, there's the disaster distress helpline, the suicide prevention lifeline, National Domestic Violence Hotline, National Child Abuse Hotline, Elder Care, Veterans Crisis. There's a lot of help and services out there, but I don't think people know. And it used to be in the old phone book, when we had phone books, that they would list a lot of this kind of stuff. And I guess now everybody can use the computer and Google, that. But anyway, there is help out there. And so, everyone deals with stress differently. It depends upon how you've been raised, what your background is, your social support from family and friends, your financial situation. I had to take a cut in pay, but only a 15% during this COVID thing. And, some people lost their jobs, so I'm certainly not complaining about that. But, I had to adjust things at home because of that cut in pay. Your health, your emotional background, all those things contribute to how you deal with the stress. And then, of course, you're always worried about getting the virus or spreading the virus. And, especially like Sandra, who owns the station here, she's very adamant about not going into meetings and rooms and church and things like that, because she's got an 84-year-old mom and she wants to keep her mom with her. And I get that. I understand that. So, I think some people are going to respond more strongly to a stress than others. Those who are at higher risk for severe illnesses. Certain medical conditions cause problems for people that have COVID. I think it's because their body isn't as strong, and somebody told me today that being overweight was a real factor in COVID death. I don't know if that's true or not. It makes sense to me, because when you're real overweight and you're not taking care of yourself, then everything isn't working as well as it could in your body. We're like a car. You've got to give us good fuel for us to run efficiently. If you put in shoddy fuel and it has some dirt in it or something like that, your car isn't going to run as well. And we're the same way. If you're putting junk food in your body, if you're eating all processed food and you're not cooking fresh and you're not eating, a lot of fruits and vegetables, then your health is not going to be as good as somebody else, and you might not survive the COVID and being on the vent. So those people are high at risk for the illness itself. And then more people for the stress is, children and teens are affected by the risks. People caring for family members or loved ones are under a high additional stress on top of the COVID. They're having to, do that for their family members. And then frontline workers such as healthcare providers or first responders. I'm going to see people that we think might have COVID, but we don't know until we test. And when we get the response back, I've been exposed to certain patients with COVID. We're very careful about, you have to wear a face mask, you have to wear protective covering, you have to wear gloves. You have to, go outside, and when you come back, you have to be sprayed down with Lysol. You have to wash your hands. You have to, wash off your stethoscope, that kind of thing. Well, here's a call. Isn't that great? Hello, this is Linda. How you doing?
Hey, you called me.
No, ma'am, I did not call you.
I'm sorry.
Okay. Well, I guess that wasn't really a call. I got pretty excited about that. But anyway, so then essential workers in the food industry, somebody told me today, she said, the food just isn't as good as it used to be. So I don't know why that is. I don't know if it is. I don't eat out much. But the places I've gone are my favorite places, and that food's been all right. So people that already have existing mental health conditions are going to have more problems than you and I. And if you use substances or you have a substance use disorder, that can really, the stress can make you want to use more. Of course, then there's the people that have lost their jobs, had their hours reduced, or other major changes to their employment, like having to work from home instead of getting up and going to the office. People who have disabilities or developmental delay are at high risk. People who are socially isolated from others. I just saw a post from a chiropractor friend of mine in Wilson, and he said, I just want to hug somebody. And our church is very friendly and very huggy, and we're touchy-feely and like to chit-chat after church and all that. And I'm grateful that our church is open and I can go to the service, but I miss that physical part as well. So the socially isolation is tough, and then it's, if you already live alone or you live out in the country, you're already socially isolated, and then you can't even go in to eat your favorite burger at Burger King without having some problems. Some racial and ethnic minority groups are in more stress than others. So there's just, people experiencing homelessness, people who live in group setting, they're at higher risk. So there's just all sorts of things that can affect your stress. So it's almost time for our second break, so I'm going to break right here before we go into some healthy ways to cope with stress. So I will see you back in just a few minutes with more of Here's to Your Good Health. Don't go away.
At Downey's Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Downey's Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Downey's Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Are you suffering from chronic pain, have aches, migraines, or just general discomfort? Ask Ward Specialty Pharmacy about their new pharmaceutical-grade, full-spectrum hemp extract, commonly called CBD. CBD has no known side effects and is available without a prescription. CBD can potentially help with migraines, anxiety, depression, insomnia, and other discomforts. Ask the knowledgeable staff at Ward Specialty Pharmacy about CBD and start feeling like yourself again. Ward Specialty Pharmacy, 3646 Sunset Avenue, Suite 110 in Rocky Mount.
The statement in this ad has not been evaluated by the FDA. This product is not intended to diagnose, treat, cure, or prevent any disease.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
Well, Heidi Ho, welcome back. This is Here's to Your Good Health. My name is Linda Prezioso. We've been talking about stress and anxiety through this COVID and the things that is causing, it's really wreaking havoc with a lot of us regular folks. Well, I guess everybody, but you know, sometimes I don't think some of the bigwigs in Washington know what it's like to feed your family by cutting hair and not being able to open your salon, or feed your family by having a gym and not being able to open your doors, or having a roller skating rink as your prime place of our source of income and not being able to open your doors. So, I mean, I get why, but I don't, never mind. It's just, it's bad. So, some healthy ways to cope with stress. Know what to do if you are sick and you're concerned about COVID-19. You can always call our office and ask that question, or the health department. And then contact a health professional before you start any self-treatment for COVID-19. And really, the only treatment is self-isolation. But, you can call and say, we can tell you drink more fluids and take Tylenol or ibuprofen for the pain and for the body aches and that kind of thing. And take care of your emotional health. Whatever you need to do, you like to walk, go take a walk in the woods. I told my husband the other night, I just want to go to a movie. We don't go that often, but I just want to go to a movie and sit and laugh. You can do things that help you think clearly. You can react to the urgent needs of yourself and your family. And take breaks. I don't even listen to the news or watch the news because there's, all these burn-ins and all these cities on fire and all this stuff going on. I don't know the answer. The only answer I know is God, and I haven't seen him doing much. I'm sure he is on the backside, but so I don't, I think you should take breaks from watching, reading, or listening to news, including those on social media, and because hearing about that pandemic repeatedly can be upsetting. Take care of your body. Take deep breaths, stretch, meditate, eat healthy, well-balanced meals, exercise regularly, get plenty of sleep, and avoid the excess alcohol and drug use. Make time to unwind. Try to do some activities that you enjoy. I love doing puzzles. And so we did a lot of puzzles during the winter, and I might pull those out again a little bit. And connect with others. Talk with people you trust about your concerns and how you're feeling. Connect with your community or faith-based organizations. Social distancing measures are in place, but consider online, mail, text, social media. And then, you've got to know what you can do to reduce your stress and understand how to do that for yourself. Because you've got to do it. You're the one who's got the stress. You're the one who knows how you react to these things. Take care of your mental health. Now, that's a big one because mental health is an important part of our overall health and well-being. It affects how we think, act, feel. It may also affect how we handle stress, relate to others, and make choices during an emergency. We talked about substance abuse, and there's more and more people doing that, and it's their way of coping. I'm not saying it's right, but that's how they cope. And then, if your stress is too high and you can't deal with it, call your medical provider. Get immediate help from a crisis hotline if you need to. And then, suicide is really going up, and this is very disturbing as well. A young girl that she used to work in our office, and then she went to a different office to work, but she comes back to our office as a patient, and I don't think she was 50. I think she was about 43, early 40s. And she committed suicide. She just couldn't take the pain and take all the stress anymore. So there's a lot more suicide that's going on, especially with young people because of all this. And so you've got to, we as moms and grandmoms and aunts and uncles, we need to be really cautious and watching for those signs of depression, suicide, thinking about hurting themselves, all that kind of stuff, because it's a real thing out there. And so we don't want anybody to feel so low and so helpless and so at the bottom of the pit that they think that's the only way out, because it is not. So, and then there's a lot of anxiety that's going on too, and behavior changes are a significant part of most anxiety disorders. Now, I get real anxious when I travel because I'm okay once I get to the airport, but packing, getting there, making sure that I'm in place for the airplane, I get real anxious. And so anxiety can do a lot of stuff to us. And I'm an anxious person naturally, and then some of this stuff just can send me over the edge. And if you don't believe me, ask my husband, he'll tell you. But, you know, we can have fear reactions to crazy things. Some people, you know, they're scared to death of a spider. Well, I love spiders because they eat flies, and I hate flies. So, you know, but some people are just scared to death of them. My big thing is snakes. Oh, I can't deal with a snake. I didn't pick up eggs out of our chickens' where they roost and where they lay their eggs because Bob saw a black snake there and shot it. So that's like, oh no, I'm done. Not with that. Okay, so we talked about compulsion is a real strange behavior that's caused by anxiety. And the anxiety goes up, you know, our compulsion might be that we have to wash our hands, or you have to check the door to make sure it was locked, or you have to make sure the coffee pot is off. And people can go back and forth and back and forth and back and forth getting these things done. And sometimes, you know, I've had one girl in our office, she has to do everything 3 times. That 3 is her magic number. And that's how she, you know, copes with that. Anxiety, cutting yourself, is a form of decreasing anxiety. And a lot of young people do that because if you can feel the pain, then you know you're still alive and you can still feel because you're so numb to all the stressors in your life. Compulsion, you know, obsessive compulsion behavior can go ahead and that can drive you crazy, drives me crazy. You know, I never realized my daughter was obsessive compulsive, and she's not real bad, but when she went to Boston for graduate school, and so I'd gone up there with her to help her get, you know, to move and get settled in her place to live and all that kind of stuff. And so we were in her bedroom, and I was unpacking her clothes, and I was taking the clothes out of the box and putting it on a hanger and hanging it in the closet. Mom, no! All the long-sleeved white shirts go first, then the short-sleeved white shirts, then the long-sleeved black shirts, then the short-sleeved. She wanted everything same color and the same length of sleeves. Well, you know, I'm just stuff it in and close the door and we're good to go. But she's a lot like her daddy in that. Her daddy's got some of those same compulsive things. One time, he can be a neat freak. He can also be a slob. But one time he was, I don't know, I think he was cooking and he was looking for some spice and he couldn't find it. Well, I put all my spices together by where I use them. For instance, all the stuff I use for baking, that goes in one spot. All the spices I use for Italian food goes in one spot. Mexican food, etc., etc. Well, he just knew that it would be much better to go alphabetical. And so he took all my spices out, put them all in alphabetically. I couldn't find a daggone thing. Made me mad as a wet hen. And so I took them all, you know, as I took them out and cooked, and I put them back the way I wanted it. Because, you know, I'm the one who does most of the cooking. I'm the one that does all the baking. I don't think he's ever baked a thing in his life. So, you know, and his way of dealing with stuff and mine are so different. That's, you know, they say opposites attract. Well, that sure is true in my case. All right, so what are some unhealthy coping tools? We've talked about substance use. That's certainly an unhealthy one. And, you know, there's the alcohol or the drugs. These are not good. Some people develop nervous tics because they're anxious. That can be shaking your leg up and down, as mine is going right now. Touching your face, you've seen me do that. Winking or blinking more. Some of them are habits like picking your nails or clearing your throat. I pick my nails all the time. My mother did that. Habits are slightly different than tics because they're a bit more under your own control, but anything like that, any automatic response is from stress and anxiety. So those tics, I'm sure you've seen some people that have it. Sometimes you can have a syndrome called tardive dyskinesia, which is, you might go like this, or, squint your nose up or something, and you do that frequently. And that, a lot of times that can be caused from a medication, a side effect of a medication you take. So, and there's, lots of different behaviors with anxiety. Anxiety can make you feel like you're going to have a heart attack. Your heart can race, you can get hot, sweaty, feel like you're going to die, you have to get up and pace, you can't sit still. All those things. I can't tell you how many young women come to me and say, I think I'm having a heart attack, or I'm having palpitations, or something to that effect. And it is, it's stress or it's anxiety. And after we do all the tests to figure out it's not their heart or it's not their lungs because they're not breathing good, then once I convince them that we should try an anti-anxiety medicine, and something you have to take every day. And once they do that, they go, oh, I feel so much better. Yeah, I know. But you've got to work with them, and they've got to know in their mind that they're not crazy. And a lot of people consider anxiety and stress being crazy, and I don't agree with that at all. I think our mental health is just as important as anything else we have, and that we need to treat it just like we would diabetes or high blood pressure. So that's about all I've got tonight. I'm kind of tired of talking. I'm going to close a minute early. So we will see you next week with more of Here's to Your Good Health. You have a great evening and stay stress and anxiety free. Good night.
I'm Daniel Moss, owner of Cornerstone Funeral Home, and I'd like to invite you and your family to give our family an opportunity to serve you in your time of need. And we offer a full line of funeral services, everything from visitations to graveside services to cremations on site with a live crematory, as well as a banquet hall to meet the catering needs of our families that we serve. We offer catering service. We offer refreshments prior to visitations and services of our family. And we want to invite you to come and experience the difference here at Cornerstone Funeral Home.
The North Carolina Department of Motor Vehicles is moving from Raleigh to Rocky Mount. What you may not know is that there was an amendment placed on the House floor to defund the move. The Spring Hope Enterprise reported on Representative James Gaillard's successful efforts to debate and defeat the amendment by working with both Democrats and Republicans.
The gentleman from Nash, Representative Gaillard, rise.
To debate the amendment, Mr. Speaker.
The gentleman has the floor to debate the amendment.
A vote for James Gaillard is a vote for jobs, rural communities, and Rocky Mount.
I'm James Gaillard, and I approve this message.
Does sorting through Medicare make you feel like this? Don't worry. Be happy. For any of your Medicare questions, just a simple call to your local team of licensed, customer-friendly agents can get you from here to there. Imagine getting the most out of your Medicare. Call 833-232-8880.
We're in our 18th year of practice at the Hammer Chiropractic Center, and we've seen over 15,000 different people in the Rocky Mount area. 40% of headaches actually come from a neck problem. Many patients come in taking multiple aspirin, over-the-counter medications and such a day, and we can get you to stop doing that and actually fix the problem so the headaches don't rise anymore. A lot of people think chiropractic hurts. It does not. Most of the people come in and they feel great when they leave.